Okay, so Lisa's gonna tell you, when we say aloha, we want a lot of feeling in it. I know it's freezing cold and it's rainy outside, especially compared to Hawaii. So let's try this again. Aloha! Aloha! All right, that's much better. So now you gotta keep all of that sunny, right, positivity inside you right now. But I really want to thank you for allowing me to join you all today. Just a special mahalo to Alan Morgan, Carrie Cochran, and the incredible team. I heard the shout outs going on right before I came on at NRHA for bringing us all together in this really critical moment that we find ourselves in. And I'll have to be honest, it was really difficult for me to prepare for today's talk. I could stand here and I could list out for you all of the rural health programs we need to fund, whether it's the Medicare Rural Health, Flexibility Program, Flex as we know it. Very good shout outs going on here. The National Health Service Corps, the Community Health Centers Program. We could talk about telehealth, PBM, reform, physician pay, workforce recruitment, reimbursements. And while all of that is really, really important, it really doesn't capture the urgency of this moment. Because right now, America is staring down the barrel of a $2.5 trillion cut to Medicaid. An attack on healthcare access that could prove catastrophic. 80 million Americans, and I don't have to tell you all this, you know it. 80 million Americans rely on Medicaid and CHIP. 1 in 4 rural Americans depend on Medicaid. The people you serve every single day. Millions of Americans, seniors in particular, millions of seniors on Medicare use Medicaid for long-term care. And nearly 40% of all children in the United States receive care through Medicaid and CHIP. These aren't just numbers. These aren't cost savings. These are our neighbors. These are our parents. These are our kids. And no matter how these cuts come, whether through per capita cuts, reductions to the FMAP floor, slash Medicaid expansion funds, or so-called work requirements, the result will ultimately be the same. Millions will lose coverage, and rural America will suffer the most. But unfortunately, it doesn't actually stop there either. The House majority is also proposing at least $230 billion in cuts to the USDA, which means, as I sit on the I committee, which means devastating reductions to SNAP. This isn't just a hit to struggling families. It's a double blow to rural America in particular, stripping funds from our farmers and taking food off the tables of those who need it most. And I don't have to tell this group, yes, you need health coverage, but in many ways, food is health care. It keeps people alive, it keeps people healthy. Thank you. Food is healthcare. So let me be very, very clear in this moment. These cuts will cost lives. We are at a breaking point. The gap between rural and urban health outcomes is not just widening, and you see it every single day in your clinics, your hospitals, with your patients, and the communities. This gap is becoming a chasm. This is our reality. Rural Americans live 3 to 10 years less than our urban neighbors. Prime working age adults in rural America have a 43% higher mortality rate than those in cities. Rural women experience some of the highest maternal morbidity rates in the nation. And rural communities are suffering and dying from preventable conditions. Hypertension, lung disease, liver disease, kidney disease, septicemia. These are not mysterious and curable illnesses. These are preventable, treatable, if people have access to care. If they have access to care. And now with these extreme budget cuts that we are facing, literally going to be debated tonight in the House, that access is about to be ripped away. What we need right now is a rural health moonshot. Not a slow incremental change, not another study, not another hope and intention, and definitely not cuts. We need bold, transformational investment in rural health care. We need to invest. No, we must invest in our rural hospitals and community health centers, not force them to close their doors. We must expand access to healthcare and mental health services, not celebrate coverage losses as savings. We must protect the lifelines of Medicaid and SNAP, not gut them for the sake of politics. Because healthcare, my friends, and you know this, healthcare is not a privilege. It's a fundamental right. It's absolutely right. It's being denied, quite frankly, to millions of Americans across all of our states and the homelands of America. We cannot accept a reality where rural Americans are expected to live sicker and die younger simply because of where they were born. As co-chair of the Bipartisan Rural Health Caucus, this is my moonshot. This is my mission. It makes me think of my friend on Lanai, who told me how hard it was to be born and to die on the island he loves because the healthcare options just are not there. I think of the mother on Molokai, whose grandchildren could not be with their dying mother in her final moments because of air transportation and because there were no hospice care where they lived. And I always think, I can hear them in my head, I always think of Uncle Eddie and Uncle George from Waianae, who repeatedly asked me, kind of yelled at me, why it was okay that their ohana, their family, lived 10 years less than people down the way in urban Honolulu. These stories are not isolated. They're happening everywhere. But we can change this. I urge you, and I know this has been a real doom and gloom, and I apologize. So it was really hard to think of what to say here, but I urge you, I beg you, I implore you, share your stories. Speak out. Show the real human impact of investing in healthcare. Not just what these cuts will do and how it will hurt, but they need to hear that too. But let's talk about the life changes that can happen when people have access. How communities can flourish and grow, economies strengthen, families staying together, but most importantly, our rural Americans being able to live healthy and productive lives. Make my colleagues in Congress listen. Because I will tell you this, my friends, in rural America, we are running out of time. We can and must fight back. We can achieve a rural health moonshot, not just to stop these cuts, but to build a better system where every American, no matter where they live, has access to the care that they deserve. And if we do this together, we will achieve something funding cuts could never achieve. We're going to give people back time. So with this, I know I could actually talk more, but I'm going to give all of you a little bit of time back, and thank you for fighting with us on the front lines of rural healthcare. We will make this happen. We will make our moonshot. We will make a difference in rural America. Thank you for what you do. Please have a safe and wonderful weekend. Mahalo, everyone.